Hi guys, it's Dr. Selene with BU Medical. I want to talk to you about a new medication that just came out called QWO. And what is QWO exactly? So it's the first FDA-approved medication that's used for cellulite that's non-invasive. So it's pretty amazing stuff. We actually don't know exactly how it works, but let's get into that in just a minute. Let's talk about cellulite. What the heck is it? Why do we have it? And what can we learn about it? So 9 out of 10 women have cellulite, and it has nothing to do with fat at all. So it's not because you're a little chubby, it's not because you're holding on to weight, it has nothing to do with that. They don't always know what causes cellulite. Why do little kids not have it? They think it's because their skin integrity is different than ours as we age. So as we age, we start noticing little dimples in areas that we didn't have before. We're putting on bathing suits and we're seeing little pockets or dimpling underneath our tight yoga pants, and it's like, where did that come from? So where it came from was that as our skin ages, we lose the integrity of it. So instead of being this firm, taut skin, we get a little bit of laxity. And our fat cells under there also kind of engorge and grow in that area. We don't actually lose or grow fat cells unless we're doing other modalities to lose them, like liposuction, cool sculpting, or Kybella. But generally speaking, we're born with the number of fat cells that we're going to have. So those get a little inflamed, and then the skin sags, and then we develop these fibrous tags that pull the skin down. So what I liken it to is, I don't know if you ever did crocheting or stitching on a little piece of one of those flat round things, cross stitching, if you ever did cross stitching. But you remember if you pulled the thread really tight, it would pull the whole area down. And that's kind of how I like to think about our cellulite, is there these little pulled dimples. And the theory behind QWO is that it goes in and breaks up those fibrous bands. Do they really know that's the way it works? No, they don't. But that's the theory behind it, is it's an injection that goes in the dimple itself, initially goes straight down, and then goes towards your head, and then goes towards your legs. And so you're essentially just breaking up that whole tag that's there. In the old days when we didn't have this, if I was doing Sculptra in a booty or trying to do a little lift, I would actually go in with a deep needle and try to break it up myself with a needle. And even would do that in the ER when I would be stitching somebody up, was go in with a needle, try to break up any fibrous tissue, hoping that it would release that skin and let it have that more youthful, undimpled appearance. So that's the theory behind QWO. They believe it breaks down that fibrous tissue. They think it could help with some of the fat in the area, and then can also help with collagen regeneration in that area. I always say if you're getting trauma with a needle or something like that, something's getting injected, your body's like, what the heck is going on? There is that possibility that collagen is getting regenerated there. So it's pretty painless. It's a very, very easy procedure, both for you and for me. So you'll see prices range wherever you're at. I personally made it very reasonable because it requires 3 treatments. So the studies show that you need 3 treatments every 21 days to get the desired results that they show in their before and after pictures. And so there are side effects. It's not ideal for the summertime because the one side effect that's almost guaranteed is bruising. As long as you go into it knowing, hey, I'm gonna bruise and it could look ridiculous, that I'm okay with that, then go for it. And supposedly the bruising decreases after every subsequent treatment. It was FDA approved only for the booty. I personally did it on my thighs because I had some dimplings on my lateral upper thighs that I wanted to get rid of, and my bruising was pretty significant. It may have been because we were totally off label. It's a different area that hasn't been studied, but it's where my problem area was. I did get some of the staining as well with some hyperpigmentation, and that's just me. I know that no matter what I do to my skin, I'm almost always gonna pigment. But it was the area that was bugging me, so I did both my booty and my thighs, and I really like the results. I think they're fantastic. Would I pay for it myself? Yeah, at a reasonable price, knowing that I'm gonna have to do a multiple series treatment, I would. And I do recommend it for patients who are trying to get rid of that dimpled appearance. There's other modalities that we have as well that can help tighten and tone. None of them are magical in the sense that they totally eliminate or kind of Photoshop everything out, but they're as good as what we have right now. So it's a relatively no downtime procedure. It doesn't really hurt. The only downtime that really is involved is the bruising. You can also get some hard nodules in the areas where you get treated. That for me personally resolved just with massage and time. So I'm the girl who gets every side effect under the sun. So I've been through it. There was also a little bit of itching on the sites where I got injected, which is normal, and there can be redness and swelling. All normal things as your body's trying to release these fibrous tags essentially that are giving you that cellulite appearance. We don't know if it's permanent. Right now it's new to the US, so we're hoping that it is, but we can't guarantee that it is. It's at least in the studies has been shown to be effective for years, which is good for most of us as we're trying to get into bikini season. And it's a wonderful medication. It's what we have right now. Maybe someday we'll have something where it's something completely different, but it's beautiful in that it's non-invasive, it's quick and easy, the bruising really doesn't hurt, and it's effective. So it's an amazing treatment. If you're curious about it, come in for a consultation. Let's take a look. There's so many different modalities we have. And with cellulite being such a huge issue for all of us, it's a solution that we finally have for a problem that's been bugging us for years. And the other solutions that have been on the market in the past have not been as great, or certainly they haven't been non-invasive. I hope that helps you guys in understanding all the different options we have in aesthetic medicine. Remember, we're here to help you and guide you in knowing what's best for you. We want you guys to look great so you can feel great, so you can do great things in this life. Take care, guys. Bye-bye.